I'm watching the TV and, between now and December 7th, I got to jump on the Medicare Advantage thing again. I'm watching this ad. And as I'm watching this ad, I'm getting more and more upset because I care about people. I genuinely, and all of us should care about our fellow persons, right? And this ad, there's a new site out that all these companies that give Medicare Advantage are using to centralize choosing the product. And you sit down and you call that number, and that number goes through not Medicare. It goes through a list of hundreds of, well, I don't know if it's hundreds, probably so, hundreds of different Medicare Advantage options to select for you based on what medicines you're taking and what things you need, etc.
Have you compared your Medicare plan recently? With eHealth, you can compare Medicare plans side by side for free. So we invited people to give eHealth a try and discover how easy it can be to find your Medicare match.
This is pretty amazing.
I can go on a vacation with this money.
I have quite a few prescriptions.
That's why people call us. We're going to compare plans, and I'm going to try to get you as much bang for your buck as possible.
That's great.
This one here covers all your prescriptions, your doctors as well.
Oh, wonderful.
I have a hard time with this.
That's okay. That's what I'm here for. Based on our conversation today, I would highly recommend this plan.
You're so helpful. You don't know.
I'm excited for you, sir. Again, my name is Cham. If you have any other questions, give me a ring.
Thank you very much.
And all people over 65 are calling in, many of them giving up their traditional Medicare because this plan sounds cheaper. The other plan sounds cheaper. And I'm pulling the hair out of my head that I don't have. I'm bald-headed. By the way, we're on YouTube as well, so you can see I'm bald-headed and pulling my... I don't even have stubs right now. I shaved well yesterday. But look, brothers and sisters, I got a long email from a dear friend yesterday, and she told me, she said, Egberto, I was on Medicare Advantage, and I'm going back to Medicare, traditional Medicare, and the supplemental, the Medigap. And she said, I'm doing that because the specialist that I want to see, I couldn't do it with Medicare Advantage. But she said, you must understand, and you must tell. She's a very smart woman. And she said, you must understand that there are some people who simply can't afford traditional Medicare because they can't afford the supplemental. And I understand that. I understand that they've put us between a rock and a hard place. But there are a lot of us who can afford the Medigap program the Medigap piece of, to get traditional Medicare, the part that pays 20%. But many of us are enticed by, hey, I can save this money. Why not? Okay. And that is what these companies bank on, that even though you can afford your Medigap plan just fine, in order to give you choices. They like to talk about, I have some folks in the chat that would say, well, private systems give you choices. It always says choice of slave master. Because when you have the one choice, which is Medicare provided by the government, guess what? You get the choice of which doctor you want to see, not which doctor is on your network, but which doctor you absolutely want to see. Which medicine your doctor prescribed to you, not which medicines are on the plan, not which hospitals are on the plan. You are the one making the choice when you are on traditional Medicare. And of course, when you get a Medigap plan that pays the 20% of that. And like I've mentioned before, a lot of folks would forgive that Medigap, that 20% because they so overcharge anyway. But remember, when you are, when you're getting your private insurance, the government is still paying for it. They're just paying a premium to those private companies. And you know what is a dirty little secret? Medicare Advantage costs more than traditional Medicare to your government, to your taxes, because they pay those private sector people more than it costs the Medicare system. And that money goes straight into the pockets of the CEOs, the CFOs, the shareholders, and the salespeople that are trying to convince you to get a substandard healthcare plan, one where they are your masters and tell you who you can see, which medicines you can take, which hospitals you can go to. So which master do you want? Do you want the plan that gives you all choices, or do you want to choose from who will enslave you? And yeah, like I said, I do understand that financial situations can force some people into having to take that Advantage plan. But let me tell you what the caveat is. Not the caveat. Let me tell you where we are at that. All of the organizations that I work with, I'm talking about the 501c3s and C4s and other types of organizations. You know, Neil Aquino, who's with the Houston Democracy Project and other organizations. What we are doing is promoting healthcare for all, which would ultimately make Advantage moot and also will make sure to take care of that 20%. If we simply got rid of Medicare Advantage, listen to this, good folks, the waste in Medicare Advantage, you know, there's this theory out there that the private sector is more efficient than the public sector. That is the biggest lie on the planet. And if you want the perfect example of that, and don't laugh when I say it, ask me to prove it. The Postal Service versus the private FedEx, UPS, DHL, or any of the others. Ask to prove it. Even though the Postal Service pays better wages, let's talk about efficiency. They're still more efficient than every single private freight company. Every single one of them. It's never true that for profit can be more efficient than a non-profit. It's a mathematical impossibility. Does that mean that I want non-profits running everything? Absolutely not. I like choices. But where it comes to healthcare, when it comes to delivery, when it comes to utilities, where it comes to the things that are of absolute necessity to humanity, there should not be an ultimate or, you know, an ultimate for profit reason. And that goes as well with healthcare. And that's why one of our major issues, major things that we're working towards are things like healthcare for all, to get rid of the fraud that is the Medicare Advantage and private sector health insurance.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.